Swayam Prabha. Digital India. Educated India.
Hello learners, I am Dr. Rekha Sharma, Professor, UGC Human Resource Development Center, Rashtrasant Tukaroji Maharaj, Nagpur University, Nagpur. In this video, we shall study minerals. After studying this module, the learners will be able to discuss the importance of minerals in human nutrition, describe the functions and food sources of calcium, identify the various deficiency and toxicity symptoms of calcium, and identify the dietary requirements of calcium. Mineral elements are inorganic substances found in body tissues and fluids. The body contains about 24 minerals, all of which must be provided by the diet. They constitute 4% of our body weight. These include calcium, phosphorus, potassium, sodium, chlorine, magnesium, bromine, fluorine, iodine, iron, copper, sulfur, zinc, manganese, cobalt, nickel, silicon, chromium, cadmium, selenium, strontium, vanadium, and molybdenum. Minerals do not provide energy. They have many functions in our body, such as tissue building, regulation of body fluids, and other functions. Like vitamins, they are required in small quantities and are vital to the body. They should be supplied daily as they are excreted through the kidney, the bowel, and the skin. The mineral elements are not destroyed by heat, oxidation, acid, or alkali. Since they are water soluble, some loss occurs due to leaching when cooking water is discarded. Minerals remain largely as ash when plant and animal tissues are ignited. Now, definition of minerals. Minerals are inorganic elements required by the body in varying amounts to carry out various body functions. A mineral is a solid homogeneous crystalline chemical element or compound that results from the inorganic processes of nature. Now let us study the importance of minerals in human nutrition. Different minerals perform their own respective specialized functions and have a variety of roles to perform. These minerals are necessary for the following different functions. First, as constituents of bones and teeth, for example, calcium, phosphorus, and magnesium. Second, as constituents of body cells of soft tissues such as muscles, liver, etc. Example is phosphorus. Third, as soluble salts which give to the body fluids and cell contents their composition and stability, which are both essential for life. For example, sodium, potassium, chloride, and phosphorus. Fourth is some minerals are required in small quantities for specific functions. For example, iron and copper for the formation of hemoglobin, iodine for the formation of thyroxine, zinc as a constituent of hormone, for example insulin, cobalt as a constituent of a vitamin, for example vitamin B12, and some other elements are essential for the activity of various enzymes. Now, classification of minerals. Mineral elements are broadly divided into two classes, namely macrominerals and microminerals. Now, macrominerals. Macrominerals, also referred to as major minerals, are distinguished from microminerals by their occurrence in the body. Macrominerals constitute at least 0.01% of the total body weight or occur in minimum quantity of 5 gram in 60 kg body. they are required in amounts greater than 100 milligrams per day. 7 minerals are required in large amounts of over 100 milligrams per day. For example, calcium, phosphorus, sodium, chlorine, potassium, magnesium, and sulfur. Now, microminerals. Microminerals are those minerals which comprise less than 0.01% of the total body weight and are required in concentrations of 1 part per million or ppm or less. Initially, these minerals were also referred to as trace minerals or trace elements, as their concentration in tissues were not easily quantified by early analytical methods. Now, in poor quality diets consumed by a large majority in India and other developing countries, deficiencies of calcium, iron, and iodine occur very often. Hence, we will study these three minerals in detail. Now, let us start with calcium. Among minerals, calcium is the most abundantly present in humans, representing 52% of body's mineral content and amounting to 1.2% of body weight. In the elementary composition of the human body, calcium ranks fifth after oxygen, carbon, hydrogen, and nitrogen. Nearly all, that is 99% of total body calcium, is located in the skeleton. The remaining 1% is equally distributed between the teeth and soft tissues, with only 0.1% in the extracellular fluid, that is ECF. The body of the infant at birth contains about 27.5 grams of calcium, while the adult body contains about 1000 to 1200 grams of calcium. All this calcium is deposited in the bone during the growth of the body. Calcium salts provide rigidity to the skeleton, and calcium ions play a role in many, if not most, metabolic processes. Now let us study the functions of calcium. Calcium is essential for mineralization of bones. It is essential for the clotting of blood. It regulates the permeability of capillary walls. It is essential for the contraction of the heart and muscles. It regulates the excitability of nerve fibers and nerve centers, and it activates a number of enzymes such as pancreatic lipase and act as a cofactor. Now let us study the factors affecting calcium absorption. It is a well-known fact that the amount of calcium that we eat need not be the amount of calcium that gets absorbed. The difference between the two is primarily due to certain factors which may hinder or enhance the absorption or bioavailability of calcium. Now, what is bioavailability of calcium? Bioavailability of calcium can be defined as the fraction of dietary calcium that is potentially absorbable by the intestine and can be used for physiological functions, particularly bone mineralization or to limit bone loss. The various factors affecting calcium absorption from the diet are as follows. First is age. Now, age influences the absorption of calcium. The absorption of calcium is highest in infancy, that is 60%, followed by the early pubertal period. Absorption of calcium is also increased in pregnancy to levels higher than 25% reported for adults. Available data suggests that in postmenopausal women, absorption declines by 0.21% every year. Thus, from 50 years to 70 years, absorption may decline by 4%. Aging also reduces renal losses of calcium due to reduced absorption and decrease in filtered calcium load. Now, another factor is vitamin D. Vitamin D is essential for the absorption of calcium. In vitamin D deficiency, calcium absorption is impaired. Next factor is phosphates and phytic acid. Excess of phosphates lowers calcium absorption. Phytic acid forms insoluble calcium salts and interferes with the absorption of calcium. Now, foods high in phytic acid include cereals, legumes, nuts and seeds, and tubers. Now, reaction of the intestinal content. Calcium is well absorbed at the normal pH of the intestines. If the contents become alkaline, calcium absorption is lowered due to the formation of insoluble tricalcium phosphate. Now, another factors are fats and fatty acid. Faulty absorption of fats interferes with calcium absorption as insoluble calcium salts of fatty acids are formed and excreted in the feces. Protein. Higher levels of protein in the diet help to increase the absorption of calcium. Now, fiber. Presence of excess of fiber in the diet interferes with the absorption of calcium. Now, presence of oxalic acid. Oxalic acid present in certain food forms insoluble calcium oxalate, which is excreted in the feces, thus lowering calcium absorption. Now, examples of oxalic acid containing foods are spinach and beet. Now, let us study calcium balance. Calcium balance can be calculated as the difference between calcium entering the body through absorption of dietary calcium and obligate losses of calcium through urine, gastrointestinal tract and skin. When uptake exceeds losses, an individual is in positive calcium balance and net bone calcium deposition occurs. Although bone continually remodels such that bone calcium turns over entirely every 5 to 6 years. Negative balance occurs when dietary intake is insufficient to cover losses despite mechanisms to conserve body calcium. Typically, approximately 25% of dietary calcium is absorbed in adults and delivered to the exchangeable calcium pool, which turns over 20 to 30 times per day. Calcium balance is controlled through an integrated response to calcium regulating hormones that affect calcium transport at three primary sites of regulation, that is intestine, bone and kidney. The most important calcium regulating hormones are parathyroid hormone, that is PTH, calcitonin, that is a hormone secreted by thyroid gland, and vitamin D. And the effects of these three are briefly discussed in the next slide. Now, as discussed in the earlier slide, we will now study the role of vitamin D, parathyroid hormone, and calcitonin in calcium balance. Vitamin D increases the absorption of calcium and phosphorus in the intestines and also promotes calcification of bones. It also promotes mobilization of calcium from bones. The parathyroid gland secretes the parathyroid hormone, which regulates calcium level in blood and calcium metabolism in the bones. It acts directly on the bone, releasing calcium from it and thus raising the plasma calcium level. It also increases the excretion of phosphates by the kidney. In hypoparathyroidism, the serum calcium level may fall to a low level of 4 to 8 milligrams per 100 ml from the normal level of 9 to 11 milligrams, and tetany may result. The symptoms of tetany can be relieved temporarily by injecting parathyroid hormones. In hyperparathyroidism, the calcium level in serum may increase from the normal level of 9 to 11 milligrams to 16 to 20 milligrams. Rarefaction of the bones and spontaneous fracture may occur. Now, let us study the role of calcitonin. Calcitonin is a hormone that the C cells of thyroid gland produce and release. This calcitonin opposes the action of parathyroid hormone. It inhibits resorption and mobilization of calcium and phosphorus from bone. It also causes a lowering of serum calcium content. Now let us study the calcium balance at a glance. Now in the upper half part, we will see when there is increased calcium level in the blood, that is more than 10 milligrams per dl, thyroid glands releases calcitonin, which affects osteoclast. The activity is inhibited, calcium resorption in the kidneys decreases, and there is decrease in calcium level in the blood. When there is decrease in calcium level in the blood, that is less than 10 milligrams per dl, now parathyroid glands, they release PTH, that is parathyroid hormone. Now here osteoclasts release calcium from bone, calcium is resorbed from urine by kidneys, calcium absorption in the small intestine increases via vitamin D synthesis, and thus calcium level in the blood increases. So this is how the calcium balance is maintained in the body. Now let us study the effects of calcium deficiency. The effects of calcium deficiency in young animals and children are: first, decreased rate of growth; second, negative calcium balance; third, loss of calcium from bone leading to the development of osteoporosis; fourth, hyperplasia of parathyroid glands, that is an overgrowth of parathyroid glands; and fifth, hyperirritability and tetany leading to death. Now osteoporosis. Osteoporosis in adults is a condition in which rarefaction or decalcification of the bone occurs due to calcium deficiency in the diet. The bones become porous because of bone mineral loss. Fractures of the brittle bones occur even after minor accidents. Pain due to fractures of vertebrae may radiate round the trunk, to the buttocks or down the legs. Now healing of fractures is not impaired in osteoporosis, and pain subsides as soon as the fractures are healed. The treatment consists in giving a well-balanced diet containing about 1 to 1.5 grams of calcium along with vitamin D, about 400 to 800 international units. Now tetany. Tetany, there is a decrease in serum calcium levels which gives rise to a condition called tetany. The symptoms of tetany are severe intermittent spasms of the muscles of hands and feet accompanied by muscular pain. Twitching of facial muscles occurs. Now let us study bone mineral density. Bone mineral density or BMD is a measure of the inorganic mineral content in bone. Several factors such as age, sex, disease, genetics, and lifestyle affect BMD measurements, and normative standards must be applied for specific groups and individuals. One of the most common disorders associated with low bone mineral density is osteoporosis and increased fracture risk due to a decrease in bone strength and an increase in bone fragility. Bone mineral density is assessed using dual energy X-ray absorptiometry, that is DEXA, DEXA. Now, dietary sources of calcium. The important sources of calcium in the diet are milk and milk products, excluding butter, ghee and cream, sesame seeds and green leafy vegetables. Milk is the best natural source, and skim milk powder is very rich source of calcium, contains about 1.37% of calcium. Ragi is the cheapest natural source of calcium, containing about 0.3 to 0.36%. Though sesame seeds are rich in calcium, about 1.45%, the calcium is present as calcium oxalate mostly in the skin. The skin is usually removed before consumption. The dehusked sesame seed is only a fair source of calcium. It contains about 0.15%. Now, green leafy vegetables are one of the cheapest natural sources of calcium, containing about 0.44 to 1.13%. Since green leafy vegetables are also very rich sources of carotene and ascorbic acid, they should be included in the diet as a source of all the above nutrients. Small fish eaten along with bones is an excellent source of calcium. Now, betel leaf with slacked lime is a rich source of calcium. Now, calcium toxicity. Elevated blood calcium can occur in association with high parathyroid hormone, hyper or hypothyroid conditions, bone metastasis, that is when cancer cells spread to bones, then vitamin D toxicity, excess intake or absorption of calcium, Addison's disease, and with thiazide diuretics. High blood calcium may be asymptomatic or can cause constipation, nausea and vomiting, increased urination, thirst, muscle weakness, kidney failure, irritability, confusion, psychosis and coma. The role of calcium supplements in eliciting hypercalcemia has always been under scrutiny. Since the efficiency of absorption from large doses is poor, no adverse effects have been found with calcium supplements providing up to 2400 milligrams per day. However, at such high levels, iron absorption is reduced and risk of iron deficiency increases. A practical suggestion would be not to consume high dose of calcium with meals that provide most of the iron. Supplements of calcium do not carry the risk for renal stones in normal individuals but can increase the risk in patients with renal hypercalciuria. Now, requirements of calcium. Requirements of calcium depend upon the rate at which calcium is incorporated into bone. They are therefore highest during periods of growth, especially during infancy and adolescence, and fall after peak bone mass is achieved at about 25 years of age. Calcium requirement proposed as recommended dietary allowance by Indian Council of Medical Research 2020 for adult men and adult women is 1000 milligrams per day. For pregnant women, the calcium values proposed is similar to the value proposed for adult women, that is 1000 milligrams per day. For lactating women, the recommended dietary allowance is set at 1200 milligrams per day, and for post-menopausal women, the recommendation is 1200 milligrams per day. Now let us summarize. Mineral elements are inorganic substances present in body tissues and fluids in small amounts. They constitute 4% of body weight and do not provide any energy. They are classified into two groups based on the quantity required by the body. Major minerals or macro minerals are required in large amounts exceeding 100 milligrams per day, and minor minerals are required in amounts less than 100 milligrams per day. In poor quality diets consumed by a large majority in India and other developing countries, deficiencies of calcium, iron, and iodine commonly occur. Among minerals, calcium is the most abundantly present in humans, representing 52% of the body's mineral content and amounting to 1.2% of body weight. In addition to the structural role in bones, calcium also performs many other functions in the body. For example, clotting of blood, regulation of the permeability of capillary walls, contraction of the heart and muscle, excitability of nerve fiber and nerve centers, and activation of a number of enzymes. Osteoporosis in adults is a condition in which rarefaction or decalcification of the bone occurs due to calcium deficiency. The important sources of calcium in the diet are milk and milk products, sesame seeds, and green leafy vegetables. These are references. With this, we have come to an end of a module on minerals, and we have studied calcium under minerals. Thank you.